I think we'll make a start now because we only have about 45 minutes. So welcome everyone. Thank you very much for joining us this afternoon for this bite-sized session. I'm Anne-Marie Reid and I'm Director of Student Education for Medical Programmes at the University of Leeds. And I have a doctorate myself. I've been through that rather painful at times journey, and currently I supervise a number of doctoral students at the University of Leeds. The panel here with us today is composed of PhD researchers at different stages in the study, and two PhD supervisors, one of whom has responsibility for as postgraduate research tutor. They will introduce themselves when we come to them in the panel. I've been asked to do a little bit of housekeeping first. So as I said, the session's due to last about 45 minutes. We will predominantly use the chat function if you have questions or comments, and we're very much inviting you to share experiences with us today. If you have a significant contribution to make, we may ask you to put on your camera and use the audio as well. I've been asked to remind everyone that the webinar will be recorded, so I hope everyone is happy with that, and the recording will be available in a few days' time. For those of you who would find it helpful, there's a function for closed captions at the bottom of the screen, so you can see the text as well that's written. If you have any technical problems during the event, please can you email events@asme.org.uk and they'll try and help you out. So that's the housekeeping done. So just a little reminder of what the session is about today. We're here really to explore the experiences of postgraduate researchers and supervisors, some of their experiences in transitioning through and hopefully beyond COVID. So we're just going to use some examples from the panel here who'll reflect on their own experiences and perspectives. And we're hoping that will be a really good stimulus for us to engage in audience discussion, because I think we've a lot to learn from each other. We've also got a number of resources as well that we might refer to during the presentation, but we'll certainly make available afterwards. And we very much welcome any contributions you have as well in respect to resources that you've found useful. So I think that's probably enough of an introduction from me. And so I'm just going to move to individual members of the panel today to give us some of their insights. So if I can just ask you, Sarah, to introduce yourself and tell us a bit about your journey.
Yeah, absolutely. Thanks, Anne-Marie. So hello, everyone. My name's Sarah and I'm a first year PhD student at Leeds. I started in August 2020 and I'm part-time, so I spend about 2 days a week on my PhD. The other 3 days, I also work in medical education, so I coordinate the clinical placements for the physician associate students. My PhD is quite linked to that, so I'm looking at what happens when qualified physician associates go and are employed in hospitals and what happens with their training and their experiences of that. Or fingers crossed, that's what I intend to look at anyway. In terms of my experiences of starting a PhD in medical education during a global pandemic, there's 3 areas I thought I would briefly touch on. Obviously, there's a lot that could be discussed. Yeah, as I say, if anything is very similar, please do comment, or I want to hear your own experiences if you've got any and you're in a similar stage to me at this point in time. So I feel like I have to start by acknowledging the obvious, really, but somewhat the most impactful aspect, which is that everything has, since I started, has been online and via a screen. So this means that there's been a remote induction to the university, to the department, to the library, to the doctoral college. It means that my first supervision meetings have been via Microsoft Teams, and it means that meeting fellow doctoral students has also been via Zoom and activities there. And a lot of that has worked really well. Some of the welcome talks for me were more a refresher because I also work at the university, but I think that means I'm in quite a good position to be able to compare the two inductions, seeing as I've had two inductions to the same university really. And mostly a lot of the materials were the same, delivered by the same people and saying the same thing. And I think it's really useful that a lot of the resources, you know, like LinkedIn Learning or Grad, you could look at the same point as being as being introduced to them. So that was really helpful. There's I think just one big difference for me though, and that was I think absorbing the energy of being in a university, studying in a university, of working in a university, whatever it is, and being part of something much bigger. And that perhaps wasn't quite there for me in comparison. So I think when I was part of the face-to-face sessions and Welcome to the University, I ended up sitting on a table that had someone looking at soil samples next to railway tracks, and somebody looking at the use of mountain landscapes in drama performances, and a new sports manager, and just having those different conversations and realizing the breadth of what happens in a university and the activity and that real sense of community. And I really enjoyed that. And I think that obviously having things online is kind of hinders that in some ways. Saying that though, I spoke to another PhD student, and they very much said that who doesn't live in Leeds, and they said that they felt much more connected because they didn't have to come up for all the events and they didn't miss events and felt much more engaged. So there's clearly some different views on that one there. So my second point really is around building momentum with doctoral work kind of during a pandemic. As the pandemic started, or my experiences of that anyway, as the pandemic had already been going for a few months before I started this PhD, I was aware I needed to think carefully about that and what that would be like. The first year, I think, as you all know, contains so much reading, and when you're not in the office or in the library, kind of having that peer pressure of working, I find it can be a recipe for procrastination. I in no sense want to dictate what works, because it's a very personal and unique thing, I think. But for me, I think my experiences have been spending a lot of time writing as well as reading more than I anticipated. And I think that's because if I'm in an office or in a library, you kind of end up speaking to someone else next to you about their experiences and kind of saying, you know, I've read this thing and it's really interesting, and you kind of have a consolidation of learning that happens there. And I think there's an element of missing that. So I think by writing a little bit more, that's brought that into play for me. I've also reached out to another PhD student who researching physician associates at a different university, and we have a catch up every couple of months, which has been really useful to kind of have that topic buddy, somebody else that's also looking at physician associates. And so that's been a really useful aspect of that for me as well. And also lastly, my supervisors have advised me to use a reflective diary along the way, so you're taking notes of what's happening, when, and what decisions you've been making. So that's kind of been a good approach for me as well. We're trying to utilize that a bit more. But saying that, I do spend a lot of time staring out the window as well, and I think that's a massive part of the experience of no matter whether it's the first stage or probably later stages, as Amy will agree with. So that's yeah, a good thing to acknowledge as well, I think. And then I think my last point, which in some ways is the most important perhaps, is looking forward from this point in the journey right now during times as they are in COVID. And I think that's about, as we all know, healthcare services and education and the system has been put under such immense pressure that it's had to really adapt and change, and there's been quite significant consequences. That can be about the organisation and reorganisation of care delivery, or it can be about workforce, or it can be about what's actually happening with training. And I think we still don't even know what ways that's going to change in the next couple of years, in the next year, 2 years, 5 years. And I think what I'm starting to think about now is how that will affect my research when I come to undertake it in a year or 2 years. You know, how much can I anticipate that? To what extent can I incorporate a post-COVID world, whatever that may be, if it indeed happens, into my research design? What do I need to consider? Could it impact ethics, recruitment, the methodology I can use or want to use, the questions I want to ask or need to ask, and the impact or outputs that I want to have? So I discussed this with my supervisors, and once again, I don't have any answers, but they mentioned engaging with stakeholders at this point as well, which I felt very early to be doing that. But I contacted the physician associate education leads in a couple of the hospitals, and we've had a chat about where things are and where they anticipate things going. And I have found that actually really useful as well, to get hopefully a bit of investment from them in this topic. So I think this will be something that will, for anybody else that's at a similar stage, that will continually need to keep readdressing, where things are going and what's happening because of such a big impact on the health system and training. So I don't anticipate we'll be able to know everything, but I think keeping asking those questions is perhaps a good idea. So those are some of my reflections from a kind of first few months, and I hope maybe they resonate with some people or raise some questions or their own experiences. So thank you.
Thank you very much for that, Sarah. And if you have got questions for Sarah, please feel free to put them in the chat, but we'll let everyone speak and then come back to them. And I liked your idea. I liked that point you made, Sarah, about that you can lack that sense of energy when you're not in a physical space and you're online all the time. Thank you. So I'll move to Amy next, who will tell us a bit about her perspective.
Hi everyone, good afternoon. A lot of what Sarah said has resonated with me quite a lot, but I'll talk about things from a slightly different perspective. So I'm a surgical registrar by background, and I'm should have been towards the end of the PhD. I'm just, I should have been finishing this month, but like everyone, I've had some big delays due to COVID. I am exploring how surgical trainees learn in clinic. And I had a meeting about starting my research on the Monday, and then clinics completely stopped on the Wednesday. So when COVID hit, I had a lot of the same deliberations as a lot of clinicians doing PhDs. What's more important? Is it important that I try and crack through my PhD? Because actually, as a surgical trainee, it might not have been useful me going back, or should I be completely going and go back to training, go back to clinical work and completely leave my PhD. Now, I was quite lucky in that at the beginning of my PhD, at the beginning of COVID, the research participants actually asked me to do something slightly different with them. Because I was exploring how trainees learn in clinic, they actually asked me to support the move to telephone clinics. So I did a quality improvement project doing that. And it was actually quite lucky that helped me decide that I should probably refocus my project, especially during COVID. So I actually transferred my project to looking at how surgical trainees do telephone clinics. So actually spending that time with them at the beginning, I think, has actually made my project stronger. But it's not just me that has problems with these deliberations. A lot of people in our office have children. So it's, well, if the children aren't at school, should we be focusing on the children? Should we be focusing on the PhD? I think a lot of people have been pulled in very, very different ways. As Sarah mentioned, we've been quite lucky in that some of those events that we've been doing have been online. And actually, I think at the moment, having that support amongst our PhD community has been invaluable. We used to meet up at least once a week for coffee, but actually those that were part-time, those that were remote couldn't always do that. Whereas we've been really lucky to have these online keep in touch meetings where we can get to know each other a little better, talk about just things that are what's going on with our projects. And actually, I think some of us have become closer as a result. And I think that's something that we really should look at taking forward. And actually, I'd strongly recommend people to do, if they're not doing already, make those connections. We've also got an international group of people doing my research. And once again, they have been so much support. We got together really early during the pandemic and said, right, are our projects working? And one of the things that we all did was reflexive sessions. So they're a little bit like focus groups, but actually a lot of people move those online. And even though I could potentially do mine face-to-face, I can get people from all over a very large hospital to attend these groups by having them online. It means that I don't have to have a focus group that I'm videoing with people with their masks on, it means that I'm not having to pull people away from their clinical work for too long, because say if they're in clinic, they can attend these meetings. So there's certainly some really positive things that I can take forward from the pandemic, and even moving on from the pandemic, to do with my research. Regarding my research meetings, I used to have them face to face. And like Sarah said, it's not quite so personal when it's online. And it's amazing because my research meetings are so much more focused now. They are, I tend to have more of my tutors attend, because if they're remote, it's much easier to find a time that everyone can attend. So I think moving forward, we will probably do a combination of the two. So it's nice to just have that little walk as we're going into the room and talk about how my supervisor's children are doing, and what they're up to that weekend, what hills they've done, which we don't necessarily get so much of online. So I think moving forward, it'd be really nice to do that. But the pandemic has also made me think about other things that I think would be useful to take forward. A lot of us take equipment into research environments and don't really think much about the equipment that we're taking forward. But this has really made me think, when I'm taking these cameras in, about the cleaning of this equipment. And even though it was something that I considered a little bit before, I think it's come much more to the forefront now, and it's something that we're much more actively discussing. So from my point of view, that consideration of what we can do to keep ourselves and our participants safe from an infection control point of view, especially for those amongst us that aren't clinician researchers, I think that's really important, because it's something that we might not necessarily get teaching on, but as clinicians, we are used to doing it, whereas I know a lot of our non-clinician researchers are finding that much harder. So I'd certainly suggest that that's something, because there's lots of work evolving on that in terms of how to do. And my next step really is thinking about how I should be writing up, and that focus on writing up. And we've been given the option locally to consider an alternative thesis, so a thesis by publication. And it's about considering those different options moving forward. So I'd be really interested to know whether other people have been given options of alternative thesis and options of different ways of writing up, and actually whether that's something that other people have considered. So I just want to say thank you again for the opportunity to do this talk today. And I would really love to hear any questions and any comments that people have.
Thank you for that, Amy. And again, if you've got questions in the, you can put them in the chat and we can pick them up once everyone's spoken. But that was really useful, Amy. And I have to say, it's been very impressive how much resilience that you've shown during your research journey as well, and looking very positively to the future. So thanks. I'm going to move to Rebecca now, who will introduce herself.
Thank you, Anne-Marie. I'm actually Postgraduate Research Studies Lead, which was a role formerly known as Postgraduate Research Tutor, and that name change links to one of the points I'm going to talk about. I have academic leadership and pastoral responsibilities for Lyme's 17 postgraduate researchers and their supervisors, and would like to attest to the resilience that they have shown during this very tricky time, and which they show in the non-COVID very tricky time of being a PGR. They're working towards either PhDs or professional doctorates in medicine, clinical education or education. In my talk, thinking about transitioning beyond COVID, I'm going to focus on the wider PGR university interface rather than the individual supervision experience, which Kamal is going to cover. And I want to draw your attention to three areas that were surfaced by the pandemic, which I think will continue to shape supervision, practice and policy, even if only by continuing to be contested. And as others have said, I want to know where our experience overlaps and where it differs. The first issue that was surfaced was the liminal position of PGRs and PGR activity in the university. The second was that it highlighted the limitations of assuming, as our university has tended to, a standard candidate and trajectory. And finally, the challenge to doctoral conventions and regulations. So, liminality. PGRs are not students. That title, the postgraduate research student, the student was dropped about 2 or 3 years ago. But the PGRs, their activities and their institutional infrastructure do not become staff either. And as a research-intensive university, Leeds has a very significant research and knowledge transfer and translation presence, but the PGRs are not researchers either. They kind of fall through the cracks. And early on, and for a very embarrassing length of time, they really were overlooked in the university's official response to and communication about the pandemic, especially arrangements for return to campus and guidance on suspension and extension. The university level guidance was that PGRs should continue as normal, which for our particular PGRs was extremely difficult, as there was a moratorium on any research that wasn't COVID related. And the decisions taken highlighted a lack of knowledge about PGR lived experience, and I think also an assumption that that area of activity was marginal in comparison with the twin pillars of teaching and research. They were dispensable. We were fortunate that a new dean of our doctoral college and a new research and innovation strategy offering a quote, university without walls, is starting to counter that marginalisation. And when that strategy was presented to us at the Doctoral College Forum recently, our dean was able to show that the research income was largely driven by the PGR activity, not by the research grant activity, and that the contribution of that activity was greater than teaching income. So as people who are familiar with university policy and strategy and politics know, money talks, but the financial contribution of PGR activity is being overlooked or misrepresented. So there is a raising of the activity, hence the name change in roles. There's a development of a workload model for supervisors, a new researcher development framework for PGRs. And the research and PGR strands are being pulled together at higher levels. How they integrate further down remains to be seen. But a very clear statement in the strategy that one size fits all expectations can inhibit excellence is hopeful. So the pandemic has put PGRs back on the map. It remains to be seen what direction we travel in. Next, I want to reflect on the potential legacy from the ways in which PGR diversity was highlighted. These differences have always been there, but I think there will be no going back from the force with which the institution and individual supervisors became aware of them. There really is no default PGR experience, combining as it does permutations of full and part-time, home and international, clinical and non-clinical, staff at Leeds University, staff elsewhere, not academic staff, not necessarily wanting to become academic staff, funded, self-funded, early, mid or late career. And our PGRs themselves span people in their early 20s through to people over 70. So that diversity meant that there was a very differential impact of the pandemic upon those people's capacity to continue their research and their experience of it. As we've heard, for some people, there was actually a positive impact with the freeing up of time for research. But for the most part, and especially for the international PGRs and their supervisors, the impact was far from positive. There were impacts on the research itself, ethics, recruitment, participation, all delayed, and PGRs were working in very cramped conditions, often homeschooling, often with technology that was not fit for purpose. We had one PGR who was not able to access their data for about 5 months because their computer at home wouldn't run the software. It had to be run on a university computer. And people who were working in laboratory conditions, which none of our PGRs were equally just unable to work. Some international students were offered flights home, but then experienced problems returning to the UK. But the impact on international students was greater in a different way. The first people I knew people who contracted COVID, were colleagues and family of international students. And the first people I knew who suffered COVID bereavements were international students. PGRs, international or home, needed psychological support to a greater extent than ever before, and supervisors needed to provide that support, and they needed support in order to do that, especially when anxiety caused conflict and difficulties in the supervision relationship. There were major differences in terms of whether PGRs received automatic extensions and whether these were funded. This is still ongoing and was initially hugely divisive, with some studentships supporting funded extensions and others not, and the focus was almost entirely on home students. A pandemic legacy, which is not yet receiving the attention it deserves, is the impact on recruitment and faculty capacity and workload. There's going to be a bulge as our current PGRs take longer to complete and maybe have more issues around negotiating the focus and the methodologies of their projects. But there's also going to be, I suspect, a real narrowing as the social and economic consequences of the pandemic bite and reduce both home and international recruitment. And this comes into focus with the relational nature of working with PGRs, which was given greater emphasis by this situational awareness that the pandemic brought us to. Research supervision pedagogy is advocating a holistic practice to recognise and support the identity work involved in doctoral research. And this will, I hope, be a lasting legacy as it builds on a lot of the academic literacy's work that I'm familiar with. And work of Sharon Clarence, Helen Swords and Pat Thompson, amongst others, are good starting points for that. Finally, I want to end by considering the changes to doctoral conventions and regulations. Like other institutions, Leeds quickly waived the requirement to be physically present for supervision, progression assessments, including final vivas, and for international students, their restriction to full-time study only with a requirement to be based in the UK, apart from agreed fieldwork visits, was more liberally interpreted. Some of these, especially online supervision meetings and vivas, were approached with great trepidation and unease. They proved to be not only workable, but in some cases preferable. As universities embrace digital transformation and the challenge of climate change, I think we'll see increasing use of online assessment. The alternative thesis that Amy mentioned is not actually a COVID-related change. It's a change that has been developed over many years and it will, although as she says, undoubtedly become part of the legacy discussion. The final challenge that I want to talk about concerns mitigating circumstances, because doctoral research is the only form of public examination where mitigating circumstances cannot be applied. And I think with the greater awareness of the affective dimension in doctoral study and the moves towards this more holistic situational awareness of the supervision relationship, it's likely that there will be fierce debate and possibly change here. Thank you.
Thank you for that, Rebecca. I think you've summarised some of the challenges for PGRs, postgraduate researchers, really well, and some of them we know are local ones but apply much more widely. And I think it's really great to highlight those and think of life beyond them. And I think the challenges as well are supervisors have been under COVID restrictions too, and we know that the mental health stress and pressures have been very significant. So thanks for that. So our international perspective now, I'm going to invite Kamal to come on and tell us her experiences.
Thank you so much, Anne-Marie, and thank you, Sarah, Amy, and Rebecca for your wonderful experiences, and Rebecca summed up some of the points that we feel as on the supervisor edge quite beautifully. So I belong to Pakistan. I work at the University of Faisalabad, and I deal with both postgraduate students as a supervisor, and also am part of the board and the academic council. So on the strategic level, we deal with them as well. So basically what happened was that last year in March is when the lockdown occurred in Pakistan. COVID was already there, but it was at a very low rate, and we were all functioning pretty normally. And then in March, there was the lockdown. So as a supervisor, we had concerns for the final year going on at that time, because they were at a stage that they had to give their dissertation in the next 15 or 20 days post that lockdown. And the Higher Education Commission prescribed online thesis defense for the first time for those students. So students who were not in final year, who had either just joined or who were midway somewhere between their postgraduate experience, they were now being aware of how technology had to be functioning for them, how they would be working online with Zoom and Microsoft Teams and other things. But the final year batch, which had been focusing on their thesis defense, and they had been focusing on polishing their doctoral work, this was the first time that they were going to have an exposure of a live defense online instead of being live. So that was one of the first challenges we faced, because a lot of institutes, including mine in Pakistan, we don't have a lot of blended learning programs. Most of our PhDs are fully on campus. So this was the first experience for both the supervisor and the student to actually have a dissertation online. That created some stress in itself, because at that time, when you're at that point in your doctoral research, from the student side, there's a lot of anxiety that everything has just changed from the way they had planned, the way they had wanted to present. Maybe some of them had wanted to show some things to us. And again, it created problems for the supervisor as well. I felt a little strained as to how to communicate to them, how to work with them. And coming to the junior students, the first years and the second years, it was a new territory for me to just initiate them online and work with them online and start everything on Zoom. And there were ethical considerations also, because I mostly deal with clinical practice students who are either working in the lab for physiology, or who are actually clinicians working in the hospital set up for optometry. So on both edges, we had a lot of challenges. Like some of my students were full-time clinicians, and because of COVID, they were on double duties. Because when the brunt of COVID hit, the OPDs and everything had to be covered by other specialities, and infectious disease and medicine were dealing with coronavirus patients. So a lot of the students, they were unable to attend a lot of the meetings. We were unable to communicate with each other properly because of the severe burnout they were feeling, because of the amount of time they were spending in wards and in clinics and in places where they had not been before. There was the added stress of the infection, that being clinical practitioners, they felt that it could happen anytime. There was the added stress of unfortunate bereavements. We had students who were infected. We still have students who are doing their doctoral research and they are infected. So as supervisors, there was a lot to catch up on how to build resilience. So that is something that we had to work on. I had to work on, as to how to communicate with them and communicate more on terms of things which were non-technical, things which otherwise I would be focusing more on their thesis work. But now we had to focus more on their well-being and how they would be psychologically motivated to continue. And obviously, health policy had to be revamped for students who were affected by COVID. We had to give them extensions. We had to change their schedules completely. For the rest of the students who were under lockdown, we did give extensions, and we did give them an offer that they could freeze the semester or take some time off. However, the Higher Education Commission of Pakistan has not as yet given an alternative thesis, like Amy said, or like someone commented in the chat box. And I think that's a very good option, and we should think about it. Apart from that, I think one of the most challenging experiences for me was dealing with international students, because like Rebecca mentioned, some of them were stuck in the country and some of them were stuck in their own home countries. And we have 4 or 5 students who actually are under my supervision, who are working in their own hospitals. And two of them who belong to Saudi Arabia were unfortunately, they were not able to leave Pakistan. And they are still in the hostel with us under proper protective care. But their research, it has been postponed indefinitely till the time the Saudi government decides to open the flights. So the stress and the plight of those students who cannot go meet their families, who cannot actually go and do their work as well, that is something which we have to take under consideration. I have to started having repeated meetings with them. I still do, to actually motivate them somehow, encourage them somehow. But because again we are under lockdown for the second time, and Zoom is not the most personal of experiences. So I think that that part where we can encourage them and motivate them, or where we can inculcate resilience, is actually a challenge in the COVID perspective. Coming to the more technical things, we had to revamp, refine a lot of researches, particularly for first year students who we knew would actually face the brunt of the lockdown for their research. But that is a big challenge when it comes to clinical researchers. For example, researchers in optometry, which involve a lot of patient engagement, they involve a lot of direct checkup. But because of the way the third wave has taken over and the amount of deaths and the amount of disease burden in Pakistan right now, we had to try and scale their researches back. We had to reduce the amount of RCTs we were doing. We had to make research more simple. We had to discourage longitudinal research. So that also, it put a lot of pressure on the supervisors as well, I think, to actually revamp the whole concept as to how their supervising will proceed. And obviously, it's not always very well received by the postgraduate researcher when you try to scale back their ambition or scale back how they're going to work. So I think that that's also one of the biggest challenges we've faced this year. Another thing which I think COVID has done, which I realize now is very important, is that we have had to make more stress on equity and diversity now than ever. We do have a very diverse amount of students, but as you know, that Pakistan is predominantly a Muslim country. So we follow all religious regulations accordingly. Like right now, we are undergoing Ramzan. So we try to give it a more easy and a more facilitatory time period for students. We don't try to involve them more in technical or hard work. We try to give them more time right now to read and to relax so that they can perform their religious duties, whoever are practicing properly. But at the same time, we had to be more cognizant about our students who were from other ethnicities, other religions, because that was something that hit me very much, that they were at home. And while they're on campus, you know, everything, we're more aware of everything. We're more aware of the festivities or the things that are coming up with them. But when they're at home and they have to go through their own particular rituals and their own culture and their own work, it's sometimes neglected on the supervisor's side. Because I'm sitting on the other side of the globe and, you know, things, they might just get past me. So I had to be very cognizant of that as well, that my students who are in minority or who are of different ethnicities, they don't feel that somehow they're being left out or they're being underrepresented in this very challenging time. So I think that every supervisor's experience has been unique. Like Rebecca said, every student's experience has been unique, every postgraduate researcher's experience. And it's a very reformative and a very sort of transformational process for all of us. And we don't have any right or any wrong, but it's just that we all have to wade through and improvise as much as we can. And personal and psychological impacts on all students are very, very important. And I think, like Rebecca's also mentioning in the chat, international students, yes, we have to cater more, because they are not only just facing the brunt of the disease or the fear of being infected, but they're also in most cases with me, my students have been faced with infected family members who they have not been able to reach out to, the uncertainty of not being able to go home, the uncertainty of not being able to meet with their children for this time period, the fear of getting infected in Pakistan and then, you know, going and infecting somebody else, or the fear of being stopped at the airport because they get a COVID positive test and the embarrassment related to that. So I think that that is the experience that we are facing, and we are trying to navigate this territory. And I think that students and postgraduate researchers, And even the supervisors who are surviving through all of this deserve a huge amount of respect and for all the resilience that they are showing, and they're choosing to continue their degrees and their professional work right now. So thank you, Anne.
Thank you. Thank you for that, Kamal. I think that's a really nice note to end on, that very positive note that, you know, we really admire the efforts people are making, both researchers, postgraduate researchers and supervisors, and working on problems together to move beyond them. I also like the fact that you picked up on diversity and making sure that all students are included, and your perspective on it may be different from ours in the UK, but the value base underlying it and the issues is similar. So thank you for picking that up. So I really want to open up now for audience questions to the panel. So you can ask a question of any member of our panel or a general question, and we'll see who would like to answer. Has anyone got any specific questions? While you are considering any specific questions, I wonder if in our audience we have any international postgraduate researchers who would actually like to come on and tell us a little bit about their experience. I think we've got a question here. I'd be curious to know more about what Rebecca said about the university without walls, and do the students think this would be a good idea?
Okay, I think it's part of the research and innovation strategy, Valerie, and linked to a desire to kind of focus around community partnership and community culture and impact. So it's kind of, in a way, it's fine words, but they're different fine words to the ones we're used to. And I don't think it's been, I'm not sure what students do think about it, because it hasn't been extensively discussed. Is this, we're talking about something that has only I think was launched about 6 to 8 weeks ago, and the devil is always in the detail with these things, because I think it will be linked to digital transformation, and I think it will be about doing things online. But I do think that there is a real strong attachment, not just in Leeds but in the community as a whole, to tradition around doctoral research. And so I think, you know, it will be interesting to see if online vivas last the course or if they become optional. It will be interesting to see whether the alternative thesis takes off. It will be interesting to see whether there will be shifts towards the submission of collaborative PhDs or workplace linked, you know, the kind of the knowledge that work needs rather than the knowledge that knowledge leads. So I think it's all up for grabs.
Thanks for that, Rebecca. Oh, someone's got a bit of feedback. I noticed that Sinead has written in the chat that she's an international student based in Australia but doing her research in Fiji. Sinead, would you be able to come on the camera and tell us a bit about that, a bit about your experience? Hi, Sinead.
They're unmuted as well. So, yeah, it's been an interesting journey. The first year was fine. I started in December 2020. So the first year was okay because you could do all your background reading and research and get your proposal and everything together. And because I've been sponsored to do this, I do it full time. But we've spent the last 20 years in Australia, in Fiji, doing work there and working in medical education and in the hospital. And then you get sponsored and you have to come to Australia for your supervision. And obviously the aim was to go back to Fiji to get the data. But now I've just had to rethink the whole thing. And so we're trying to do Zoom interviews. So we had our first Zoom interview yesterday, and it's tricky because it's a third world country, the internet isn't as great. And so, you know, the Zoom, goes in and out. And so I'm now trying to transcribe, and you're trying to listen to exactly what the person was saying. And, you know, Fiji is a very sort of collectivist culture. And so they much prefer seeing you there, and they'll open up more when you're there rather than doing it like this on Zoom. So I think it's going to be a challenge. Obviously, my qualitative research as well was supposed to be looking at being there and seeing what educational leadership is like in Fiji. And so experiencing that. And although I've been there for a long time and understand, obviously, things have changed for the last 2 or 3 years, COVID and everything. I think we're very fortunate in Australia because we haven't had too many lockdowns. So I have been able to meet my supervisors mainly face to face. We had a few months there where it was just on Zoom. And I think I had the same experiences. It's very much more direct to the point, less niceties around, you know, when you meet face to face. And I think for me, I prefer some face to face interaction. Although it means that I can join things like this because, you know, you're in England, I'm in Australia, I can join in, it's fantastic. So, you know, I think there are pros and cons to it. You know, I think maybe we need a mixed mode, some online, some face to face.
Thanks for that, Sinead. Thanks for sharing your experience. And what struck me when you were talking about doing your interviews on Zoom is I think that can work well, but I think what we forget is all of us now are used to working on Zoom, attending meetings, having supervision meetings, and you do get a little bit more relaxed with it. But if I think back to the first meetings, everyone being very awkward and not quite timing when they speak. So I can understand with your research participants, for them, it's quite a challenge, isn't it, being free and open, and I guess one of the things you can do is reflect on what difference that might make to your data and bringing in those cultural context issues, as you said, a more collective society and approach. So thanks for sharing that.
You're welcome.
Good luck with it. And we've got some resources as well at the end that we will suggest. And one of the resources is a paper from Medical Education on developing online communities of practice. And it links a bit to something Amy said earlier for the peer support and so on. And I think that's going to be useful. I'm just going to check the chat now. So thanks, Sinead, see if there's anything else. Rebecca's saying that there might be a risk that we shy away from interactive qualitative approaches and default to surveys. Did you want to say any more about that, Rebecca? Because I think that's quite an important point moving forward, isn't it?
I think so. I think it is just an observation because I mean, my research sort of background is in an ethnographic space, and I think there is so much that's important there about entering the field and building the relationships and working with stakeholders and doing, you know, kind of co-constructed research. And the kind of precondition of that is that it's a relationship and it takes time to build. And I think if people are not coming into the space, the digital space, you really can't do that. Or you do it with great difficulty, and so people may well think, well, I've got to do something. I'll send a questionnaire, or alternatively, you talk to the people who are willing to talk to you, and you don't get to talk to the people who might have the more important things to say, but are going to need more kind of networking to feel safe and to trust you. So I think it's something to watch out for.
Yeah, I think that's a really good point, and it's just missing. I mean, you can see quite a lot of non-verbal communication online, but it just isn't the same, is it? And I find that people are very aware of the fact that if you move around online, it's quite distracting, whereas in a face-to-face conversation, it's quite not natural to do that, isn't it? And so it is quite different. And Mikhail was making a really good point there about the fact that international students often come to the UK or another country to do their PhD, because for them it's the experience of living in another culture, perhaps bringing the families over, developing new networks, international collaborations, and actually if they've come to another country and then they're locked down and not able to make those relationships, the families, I'm sure, will be very homesick as well, and they're not getting the opportunities for that real face-to-face being part of a community. I just think that's a huge challenge for people. And in the UK, I think at the moment we look as though we're in a fortunate position where we're sort of moving out of lockdown, which I'm sure we're all pleased about. But I am very minded that that's not the same across the world, as Kamal is just indicating. And we know in India as well, sadly, the rates are very high. But so I think it's how we work together to support each other internationally. And I think there's a real will to do it, and a real, if nothing else, I think COVID has shown us that we actually have more in common than we have different from each other. And it's working together, we can do it. So Valerie was saying, yeah, there may be more opportunity to set the online data gathering in. Is that what you did, Amy? That was what Valerie was asking.
Sorry, I can't see the chat for some reason. I've been thrown off. So was the question about?
Valerie was just asking about your online data gathering, what exactly you were doing there.
Yeah, so I'm still doing all of my ethnographic approach face-to-face, although I am looking at telephone clinics now instead of face-to-face. And a lot of that was just due to the fact that there's much less people in the room when doing telephone clinics than face-to-face. But my reflexive sessions, which are a little bit like focus groups, they're all being online, but I've not moved any of my data collection completely online. It's just about those supportive methods to do that.
Thank you for that. And Rebecca said she was just wondering what other people thought about Sarah's point. Sarah said she's had more time to write, and if other people had that sort of similar experience, or if they thought that might be helpful. Yeah, and Kamal said yes, that being able to write more, it really helps you with your structuring and stimulating your thinking. Do you want to say a bit about that yourself, Sarah, about the...
Sure, yeah, I think there's lots of different ways. I think certainly we've had meetings with the Keep in Touch meetings. We've discussed the different methods of people for note taking, and I was quite surprised by all the different approaches to it, and certainly whether they should be done, physically writing notes, or whether it should be done through writing via a laptop and on Word. So it's definitely each to their own. But I think for me, I think that's just understanding there's different forms of writing. So if you're like highlighting texts and writing and notes and typing, so the typing can be kind of quite quick, whereas writing notes slows you down and makes you think more. So I think it's just, taking that time, being in a more isolated, being at home writing atmosphere, to understand those different methods and how I use them for different reasons, and how they make me think in different ways, or progress in different ways as well. So I guess that's a little bit more about my approach to that.
Yeah. Okay, Sarah, thanks for that. I think that's a good point to end on as well. And you mentioned, so the writing gives you time to process things and think. You mentioned looking out the window as well, and whether that's a waste of time. And I don't think that is. I think that's part of your mindfulness and your consolidation. But I'm going to have to wrap up now because we're running out of time. I'd like to say thank you very much to the panel members, to Sarah, Amy, Rebecca and Kamal for the contributions today. We've had some really good comments and in the chat around that. Thanks to Lee and Jenny, who've been in the background from the ASME office managing everything for us today. But I would particularly like to thank all of you for joining the ASME Bite-Size, and I'm hoping that you found something of value for you today and you'll carry on the conversation with us through our various ASME groups. The video of the event will be available in a few days' time on the ASME website. I've been asked to let you know as well, our next bite-size session is the 20th of May at 6 p.m. and that's been delivered by the Mindfulness Special Interest Group, and it's called Peace in Times of Pandemic. And I think certainly I would recommend it to your PGRs or the supervisors as well, as ways of coping with some of the challenges we're facing. So I'm going to finish there to say hope everyone has a good weekend, and that we all move forward together and keep in touch with us in the ASME community. We're always here interested in what you've got to say and to learn from you as well. Thank you.